Welcome everybody to the call. Dr. Morse, we're recording, so if you want to get started. Dr. Morse, you might be muted if you're talking. Dr. Morris, I'm not sure if you're talking, but we can't hear you.
All right, I was using my, okay, hold on. I was using my phone for audio and obviously that wasn't working, so I don't know what, just the new technological problem for the week. So I was saying, if you can't see my slides, because I know that's been a problem before, unmute yourself and say something because I can't see the chat box, or Janine, let me know if someone chats that they can't see it. So I have my slides up now. Just a reminder, this is for school staff and health department staff. Otherwise, please drop off the call. These slides and recording will be posted on our public websites. Make sure you disseminate information to those who need it. I also wanted to say next Wednesday is the 1-year anniversary of when the first cases were reported in Michigan. I won't see you until or talk with you till the 11th. So I just wanted to make sure you were aware of that. We've made it a year. Obviously, those of us on the call have stuck it out, are still in our jobs and somewhat sane. If we're still having these calls in another year, I don't know what we'll do, but I just wanted to mention that. So the new epidemic orders have just been put out and they go into effect at 12:01 a.m. Tomorrow. So tonight, basically. Just a reminder, just because things are now legal, different things are legal, it doesn't mean it's the safest thing to do. So I used an analogy earlier today with someone about, just because our laws say you don't have to wear a helmet when you're riding a motorcycle, it doesn't mean it's the safest thing to do. The fewer people we have crowded together, the less chance we're going to have of COVID spreading, especially now that we have a variant really on the rampage. So really just keep that in mind, that we still want to do it safest as much as possible. This is a bit tricky to read, but just some comparison on changes. On the right-hand side is just some highlighted things from the last order. On the left are from the new order. This is the only things that are different between the two orders. So they've changed it from 10 people, from 2 households for residential gatherings. Now they're saying you can have 3 households with 15 people, although I've never known anyone having a gathering in their residential home, to legally have an issue. But that's now the guidance, is you can have 3 different households up to 15 people in your own home. And then non-residential gatherings can be no more than 25 people. And we'll talk more about what that means in a second. And then outdoors, it's 50 at residential, and non-residential up to 300. These may have been stated in other areas, but now it's just put in under number 2. The gathering limitations do not apply when it has to do with employees and a customer relating to service. And so I know we had a question once about like teachers meeting with parents, and it'd be more than one household, things like that. To me, that falls under this, it's part of your work. So those gathering restrictions don't really apply. And then gatherings for a funeral, up to 25 persons. So the big one that would apply to things you're doing within your school is the gathering restrictions for entertainment facilities, recreational facilities, not so much the food service. I put down here the definition of entertainment and recreational facility. That is in the top section of the order. Entertainment and recreational facilities include auditoriums, arenas, concert halls, performance venues, sporting venues, stadiums, theaters. So when we're talking about things like drama, band, athletic events, those all fall into this category. And in previous communications with the state, when asking them about events like that, when you're having performances, it does not include the performers. So if there's a limit on the number of people, it doesn't include the performers are not counted in part of that limit. So people in activities together, so like people sitting together, can't exceed 25 persons. Again, honestly, I personally feel it's best to try to stick with single household units sitting together. The more clumping you get, the more spread we're going to have. Plus, it gets to be a bit tricky to try to, split hairs. You can't exceed 50% of the fire marshal maximum, whereas before it was 20%. Yeah. Groups must still be 6 feet apart. So again, if you were at the 50% max limit, but with that capacity could not keep people 6 feet apart, then you can't have that many people. So again, you need to be able to meet all these regulations. Indoor stadiums and arenas, that's not a gym, that's a big indoor stadium or arena. You can't have more than 375 patrons if it's a 10,000 seating area, and then you can have more if it's more than 10,000. For indoor entertainment or rec facilities, so that would be like a high school gym, no more than 300. So again, those are all increased numbers from the previous order. But again, if 300 is more than 50% of your fire marshal limit, you have to stick with the lowest number. And again, that's what's permitted by law. It may not be what's safest. I will just interject in here. It seems like a good spot to say it. It had been brought up by someone between meetings that during like basketball events, some schools may not be opening both sides of the bleachers. And so there's just one side of the bleachers open for seating. If possible, it really is best if you can open all your bleachers so that there is more room for seating, so that people are as least crowded as possible. I know that may be more work for your staff, but again, the more seating you can give for people to choose from, the more spaced out people can be, and the less chance you're going to have of outbreaks and needing to shut things down. So this is just about dining. I just copied and pasted all these changes in here for you. And then libraries can be up to 50% of occupancy. That may impact you guys. So those are all the changes. That's the only things that have changed. Everything else is the same in the orders. And those you can find in the same place as usual. There's infographics and FAQs and everything there. This next thing I found as an update on the CDC website, there's a lot of text that goes along with it. I just copied and pasted some of the graphics, but the CDC has just some nice information about ventilation, recommendations and suggestions, and it's in their school section. But that was just one of the updates they had this week that I thought was interesting and just wanted to share and let you know it was there. This is just a reminder from last week for anyone who might not have joined us. Last week, I shared just a 2-pager on contact tracing. for times when you have someone contagious on your sports team, or you find out about a positive individual on the opposing team and your team was exposed, so to help you with contact tracing. That should have been sent out to you, or it's been placed on your health department's website. I did just copy and paste it in here. This is just one of them. It's on District 10's website. I just pulled one of them. So if you can't find it, or you need that copy, you just can't find it, you can just email me and I'll send you a copy. But that should help you with those contact tracing situations. We also shared this, which is just some basic, hopefully simplified information on travel. It just goes over essentially the CDC recommendations, but just hopefully in a more simplified manner than trying to hunt through the CDC website. So again, that was shared last week. Again, it was either emailed to you and or placed on our websites. And if you need help finding it, just email me. And again, this was information on the CDC website. I just put it in what I hope to be an easier to understand format where you can kind of have your families or your staff understand what's more safe or less safe when they're planning their travel. So to look at our data, I'm gonna change my view here, so just hold tight. Okay, so give it a second. All right, so you should all be able to see the current data. So currently, the state, so it's the fact that our orders have been opening up more gatherings and loosening up on restrictions is happening at a time when we're seeing our cases and our percent positivity starting to plateau, and some suggestion that we might actually start seeing some increases. So we're at a little bit of a nerve-wracking tipping point. You know, we know everyone's getting frustrated with restrictions. So, you know, at the state level, they're trying to loosen up things. However, again, we're at a point where we need to be careful because we're not going down anymore. So, so just to be aware of that. Central Michigan's numbers, on average, our cases per million have gone up from last week, and our percent positivity has gone up. So just to be aware of that. For District 10, same thing. Cases have gone up and percent positivity has gone up. And mid has actually gone down a little bit, but for the most part, it's been pretty stable from last week. So we'll share this data so you can look at it, but overall things are starting to level out. I will quick flip back to my slides and show you. PowerPoint. There we go. Okay. So this is, again, a nice summary that's done each week for the state. And so again, the case rates for the state have plateaued. The hospitalization and death rate was down just a little bit. So again, those tend to trend behind the case counts. These are the curves for the state. So percent positivity, again, is starting to plateau. The daily cases, this grade bar here is grade because it's not very accurate in this section because they date it by the onset of symptoms. And so when you get someone who's positive today, it might change your data back 7 days because they'll report that their symptoms started 7 days ago. So the more recent numbers, you know, again, you see it looks like it's dipping off here, but in 5 to 7 days that might come up because we'll get more reported cases. And it's a little confusing, but basically it's like, don't get falsely hopeful by that dip down because it'll come up in a few days. But anyway, the cases are plateauing and the hospital rate, you know, when you look at the curve, it is starting to level off. So statewide hospitalization trends, this curve actually shows a little bit of an upturn. These are in total numbers of hospitalizations rather than the number per population. But hopefully it's just a blip right now, not going to be a continued trend. So our variant cases throughout the whole US, the variant B117 is up to 2,400 cases that have been found. You know, certainly there's going to be more of them because not everything's getting genotyped. The South African variant, there's been 53 found in 16 different states, and the Brazilian variant, there's been 10 found in 5 different states. We only have the B117 right now, but as of a few days ago when this was put together, there were 437 that had been found in 19 counties. We very likely have this variant within our counties. It's just not been identified yet. And it's definitely more contagious and spreads more quickly. So again, just another thing that we just need to be careful about. I left a blank slide in there. All right, so the number of outbreaks in the state, outbreaks have actually been down just a hair from the previous week. There is always about a week delay with how reporting is done. But nursing homes or long-term care facilities and schools are the top 2. Definitely, you know, long-term care is way ahead of the pack, but hopefully with vaccinations, we'll start to see that dropping. With our schools, there was a slight decrease in the number statewide, and there's a little bit of a decrease. So high schools did have an increase. I know in some of the southern counties, they're seeing quite a few sports-related outbreaks occurring in those areas. In our 19 counties, there have been no new outbreaks. For one particular county I cover, they do have one new outbreak. The way things are reported, so this is coming off of the state website, we turn in our report to the state on Thursdays, and then the state updates the website on Mondays, and the new outbreak that we had did not get fully confirmed until late on last Thursday, so it didn't get reported to the state for this cycle, so it'll be on next week's report. So just so you're aware of that, we actually did have a new outbreak last week for one county, but again, it was confirmed after our report got turned in. So so that's why, you know, again, with looking at, you know, the other report saying there's decreases in outbreaks, yet we're starting to see some potential increases in cases. There's always a week or so delay with how we report outbreaks. There's just no way it can be real time. It's really challenging. So, but this previous week, we did see a definite decrease in outbreaks. So hopefully we will continue to see that. The turnaround for testing time, there was, I know you don't have last week's numbers here, but I did look. The commercial testing time turnaround has gone up about a day. Everything else has been stable. Much of the testing that we have done in our areas are done by our local hospitals. But so hopefully you're not seeing huge delays in testing turnaround. But that's just of note. There was a slight increase there. And I just threw this slide in again. This is just data based on GPS data. And this actually comes from the federal government, the Bureau of Transportation Statistics. So this is the percent of people that have been staying home. So you can see it's been just continually dropping, and it's getting very close to where we were back in 2019. In fact, it is pretty close to where we were in January of 2019. And this is the number of trips people are taking by automobile. And this was 2019. So that's just been continually increasing and is essentially at pre-pandemic rates. So just again, a gentle reminder that we're not out of this yet. We're at a real pivotal point right now where we could really go right back into a big increase in cases and end up right back to, times like November again. So that is all I have for my slides. I will once again turn off my sharing and we can go to questions. I will try to find them here. All right. I think it's today. Let me just make sure. So information on the vaccine wait list. Will caretakers of special needs be able to receive? So people on the call from my other health departments can answer this for me. But as of Monday, the state was going to open it up to everybody over 50, and then those that care for people with high-risk health conditions. Our health departments have made some different decisions. So again, I don't want to misspeak. Is there anyone from one of my health departments, well, from mid or from central or district 10 on there? I know there's a little difference between the 3 health departments and how they're doing this.
Dr. Morris, this is Kevin from District 10. So what we're gonna, excuse me, from a regional perspective, we have made the decision along with the other health departments and health officers from the northern lower Michigan area and the UP that we are going to be moving to opening up vaccination to those 50 and older, and all of the and then the 1BC group would be included in with that. So those will be the changes that those will be the guidance that we'll be using moving forward, in addition to all of the other prioritization guidance that's out there.
So
Kevin, this is Janine.
Oh, yeah.
We're also including caregivers, right? Caregivers of individuals with special needs. So 3 different groups now.
But we're not limiting the 50-year-olds to those with health issues or health disabilities. It's going to be 50 and up across the board.
So 50 and up, and then all essential workers that are listed in the category, and we are going to be communicating this out this afternoon. And then the third is caregiver of individuals, whether children or adults, that have special needs. Those 3 categories.
And again, that's for Central and District 10. I think I haven't heard from Mid, but I think Mid. So Greg.
No, I'm on here.
Yeah.
I raised my hand and nobody noticed. Yeah, so we are going to follow the state guidance. So we'll be opening it up to people over 50 with high-risk medical conditions and caregivers of people of children with high-risk conditions. We will also continue to follow the state guidance that says 75% of vaccine should go to people over 65. In our jurisdiction, vaccine has not been allocated the same across the state. And in our jurisdiction, we have used all of the vaccine that we have gotten promptly. But in spite of that, we still have about half the people over 65 who still need to be vaccinated. And those people are at risk of dying, and they've been waiting. They've been on our list for weeks. So we are not going to freeze them out and start doing other groups of people. We're going to continue until we make really good progress on our over 65s. So there will be some opening for these other groups, but we've got to finish our over 65s. And again, we've used every single dose of vaccine that we've gotten right away, and we'll continue to do that until we get these people who've been waiting taken care of.
This is Janine with DHD 10. I think it's safe to say across all our health departments that we are still prioritizing those 65 and older. They are still prioritized first and will be scheduled first. So that is going to continue.
Thanks, guys. The next question is, what determines an outbreak in a school system, and does this require a shutdown? So one is, it does not require a shutdown. It's kind of a case-by-case basis. The definition of an outbreak is 2 or more laboratory confirmed cases among students or staff with onsets within 14 days of each other that are epidemiologically linked. And by that, that means that they've had some kind of connection, whether they're in the same classroom, they went to the same school event, they're in the same extracurricular activity, they ride the bus together, and also that they're not in the same household, they weren't identified as close contacts of some other situation, so they, you know, aren't in the same after-school church group, things like that. So, so that is the official definition of a school outbreak. So, you know, if you have two cases that are connected and that's it, and you can effectively do contact tracing, you know, that wouldn't necessarily require a shutdown. If you had really big numbers of quarantined and, you know, it was felt more efficient to just put everyone to remote learning, you know, again, that would be a case-by-case basis. So patrons only means guests and do not include participants. Graduation does not include graduates and staff. That one I would probably want to confirm with the state. When I was asking them that, that was with regard to like a band performance. So when we're talking, you know, that large of an event, I'm not sure on that one. Again, we were talking about a performance, and they said it didn't count the performers. So again, the question was, you know, would it include graduates and all the staff participating? I'm not positive on that one. So the disclaimer is, all I know is what I read in the order. So I'm certainly no expert on these, and some of the minutia, I'm just not the expert on wheedling them out. Michigan High School Athletic Association sent out a letter indicating gym capacity at 375 instead of 300. Oh, Michigan High School Athletic Association. So when I was asking the state previously about gym capacity, they told me, I'm trying to scroll back up to those slides, that when they talked about indoor stadiums and arenas, they were talking about large stadiums. So like an indoor, like Silverdome kind of thing. I don't, you know, they said it wasn't a gymnasium that they were referencing. So again, I think we all know that the High School Athletic Association and MDHHS are typically not on the same page. So I just know what MHS or MDHHS has told me, that when they say indoor stadium, they do not mean a gym, but I don't have that in writing. So that would need to be clarified. Again, you still have to have people sitting 6 feet apart, and you still cannot go over your 50% maximum capacity. Kindergarten registration, how should we plan for it? Bring families in, appointments. I think appointments would be the best. Again, you want to have as little crowding, as little number of people as humanly possible. So do as much of it remotely as you can, and then try to have appointments so that there's no crowding. And then also too, if you do find out you had someone who was positive, you know who all was present when that other person was present. Does that mean any age adult who cares for a child with special needs? I have a feeling as we get doing this, there'll be more specific information put up regarding who is eligible for vaccination. I don't know that we have that all worked out or specified yet. So unless one of my colleagues wants to clarify, I will just say, watch our website for specifics as to who will be eligible for vaccination when it comes to caregivers.
Dr. Morse, this is Marcus, I did hear on a call yesterday, somebody said, yes, any age adult. So that's not in writing. It was a single voice on a single call, but they said, yes, we mean if you're the primary caregiver of a child with a disability, yes. Doesn't matter. If you're 19, we'll vaccinate you.
All right, that's the last of the questions in the chat. Does anyone else have any questions? And you can feel free if you're on the phone to unmute yourself. All right. Well, we'll get these slides out, and if you need any of those handouts, if you can't find them on our websites or in your inbox, just shoot me an email, and have a good rest of your week.